Welcome to the deep dive. We're tackling a really big question today. How do all those external things, our environment, who we know, our social circles, how do they really shape our mental well-being?
It's incredibly complex.
Right. And traditional research methods often struggle, don't they? It's hard to
Yeah.
capture all those intricate layers, those dynamics.
Exactly. That complexity is the core challenge. But what if there's a new way, a really cutting-edge approach that could maybe revolutionize how we understand this?
Okay, I'm intrigued. What are we talking about?
We're talking about something called generative agents. These are essentially AI entities powered by large language models, LLMs, and this deep dive is all about exploring how this tech could, well, transform mental health research.
Generative agents. Okay, let's unpack this. We know that mental health isn't just internal, right? It's heavily influenced by socio-environmental factors.
Massively.
Our sources point to everything from air pollution, noise, how our cities are built,
Urban infrastructure.
all the way to family dynamics, social networks, even things like climate change anxieties.
Yeah, the sources link conditions like anxiety, depression, even psychotic disorders to these kinds of influences.
And the really crucial part, many of these factors are modifiable.
That's the key point. There's potential for intervention there. But studying these interactions, that's where it gets tricky.
How so?
Well, current research often relies on observational data. Looking at large groups, finding correlations.
Which is useful, but...
But it struggles to nail down direct cause and effect. It's really hard to see how different factors combine, sometimes in ways that are more than just additive, what researchers call super additive.
Like the combined stress is much worse than just adding A plus B.
Exactly. Imagine losing your job and having serious family issues at the same time. The combined impact might be devastating in a way that's disproportionate. Untangling that in the real world, it's like a huge mess of variables.
Okay, so that's the problem these generative agents are trying to solve.
That's the idea. Here's where it gets super interesting. The sources talk about these computational agents interacting autonomously in virtual worlds.
Simulating human behavior.
Right. But now, with powerful LLMs like GPT-4, these agents become much more sophisticated. They're not just simple, rule-based bots anymore.
How sophisticated are we talking?
Well, think about it. LLMs are trained on truly vast amounts of human text and interaction data, so they can learn to mimic cognitive processes, thoughts, maybe even emotions to some extent.
Wow.
They can self-report symptoms if you ask them, or you could give them standard mental health questionnaires within the simulation.
So they're acting like virtual participants.
In a way, yes. There was this key study, Park et al., where they created a virtual village. The agents showed really believable social behaviors, they formed relationships, they even had memory and could reflect on their experiences.
That sounds almost uncanny.
It is. It highlights the potential realism.
So, okay, if they can do that, what does this mean for mental health research specifically? What kind of doors does it open?
Imagine creating, say, data-driven virtual cities or modeling complex family systems.
Okay.
Researchers could then systematically change things, introduce simulated adverse events, bullying, job loss, or maybe alter access to green spaces or public transport quality in that virtual city.
And then watch what happens to the agent's simulated mental health.
Precisely. You can study the impact, the causal links, in a controlled way. You can run those what-if scenarios that are just impossible or deeply unethical to do with real people.
That's a huge shift, being able to test interventions or exposures directly.
It really is. But of course, it's not without its challenges. We need to be realistic here.
Right. What are the main hurdles?
Well, for one, there's bias. LLMs learn from human data, and that data contains biases, especially regarding minority groups or maybe non-Western cultural contexts. That's a big one to address.
The simulation might reflect societal biases or even amplify them.
Potentially, yes. Then there are the computational demands. These simulations are complex. They need a lot of computing power. That can be a barrier.
Makes sense. And how do we know the simulations are actually accurate?
That's the critical validation question. Can these models replicate known psychological findings, like the established link between neuroticism and affective disorders? Or can they model why adolescence seems to be such a vulnerable time?
So they need to prove they align with what we already know from real-world studies.
Exactly. Rigorous validation is absolutely essential before we can truly trust the outputs.
So bringing this all together, this deep dive suggests generative agents aren't maybe a replacement for traditional methods, but a potentially powerful complementary tool.
I think that's the right way to see it, yeah. They let us test things we couldn't otherwise test, explore dynamic systems over time.
Helping bridge those gaps in understanding cause and effect.
And hopefully, ultimately, design more effective, more targeted interventions. Think about public health, urban planning.
The potential there seems enormous if we can model how environments impact well-being with this kind of detail.
It opens up new possibilities for prevention and creating healthier communities.
It definitely feels like a technology with profound implications. But it also makes you wonder, doesn't it? As we get better at modeling human experiences, even difficult ones like suffering, what are the ethical responsibilities that come with that power? Something to think about.